Yes, vaccinations for adults are recommended by the WHO, and the some of the vaccines which are recommended include the influenza vaccination. The influenza vaccination is advisable for all age groups and it is given once a year. It prevents the flu infection, which can lead to more serious complications, especially in young children and in the older age group. The other vaccination that is recommended is the Tdap vaccination. The Tdap vaccination covers and protects you from tetanus and diphtheria and pertussis infections. The other vaccination that is recommended is the pneumococcal vaccine. The pneumococcal vaccine protects against the Streptococcus pneumoniae, and there are two vaccines that are available for adults. The first is the Prevnar 13, which is a single dose which lasts for life, followed by the pneumococcal vaccine 23, which is a polysaccharide vaccine, which is usually given after an year of taking the Prevnar 13 vaccination. This vaccine, the pneumococcal vaccine 23 or the polysaccharide vaccine, it gives you protection for 5 years. And this is recommended for all adults above the age of 50 in India, and at any age if you have certain risk factors. The shingles vaccine is another vaccine which is recommended for all adults over the age of 50 years. This is to prevent the herpes zoster infection, which is a reactivation of an infection caused by the chickenpox virus, and this can be very painful. So the shingles vaccine is now recommended for all adults to prevent this herpes zoster, which is also called as Nagin in Marathi. The HPV vaccine or the human papillomavirus vaccine is recommended for all males and females up to the age of 26 years to prevent HPV infection, which can cause genital warts and can also lead to cervical cancer in women. Hepatitis A and B also can be prevented by taking the vaccines for these infections. The hepatitis A is usually given in childhood itself. Most of the pediatricians nowadays, they give the hepatitis A vaccine. The hepatitis B vaccine is indicated for certain types of people who are at risk of developing or catching bloodstream infections. These typically include patients who will be requiring dialysis, hemodialysis for kidney problems, as also for those who may require certain periodic blood transfusions. It is also recommended for all healthcare workers and other people who are dealing with these type of occupational hazards.